what does that really mean? Well, the weekly study by the Office of National Statistics gives the most reliable snapshot of the epidemic. It tests random people, whether or not they've had symptoms. The latest date, 12th week of October, shows almost 28,000 people a day were being infected, up from a little over 7. It estimates that 1 in 160 people had the virus, up from 1 in 240 the previous week. A rise in infection leads to more hospital admissions around 2 to 3 weeks later. And the latest government stats show 844 people have been admitted to the UK hospitals over a 24-hour period. That's up from 603 a week earlier. But the pressure is building faster in the hotspot. So, in the northwest, admissions are up 73% in a week, with doctors warning beds will soon be full. In the northeast and Yorkshire, they're up 49%, and in London, they're up by 55%. But elsewhere, the epidemic is in a very different gear, with much lower admission rates. To get the R number below 1 and shrink the epidemic, the government needs to reduce the contact between people, whether that's through its 3-tier system or a circuit breaker. But the Office for National Statistics has released another report with some worrying data. 2 weeks after the Prime Minister urged people to work from home again wherever possible, the proportion of people commuting actually increased to 65%, the highest since lockdown started easing at the end of May. And the message isn't getting through. More mixing of people means more spread of the virus, and that really doesn't bode well for the future.
Well, it's not what you'd expect to hear from the global fiscal watchdog, but the message to Rishi Sunak from the head of the International Monetary Fund was clear. Now is not yet the time to balance the books. The Chancellor has faced criticism from local leaders for providing less generous financial support for businesses in lockdown areas. And in an exclusive TV interview with Sky News, Kristalina Georgieva said the UK must stand ready to spend more during the second wave of the pandemic. She's been speaking to our economics editor, Ed Conway.
It was the defining message